How you guys doing? It's your favorite massage therapist Joseph here at Advanced Chiropractic Relief with Dr. Gregory Johnson. As you just seen on the video before, Robert here was getting his first adjustment with Dr. Johnson, and now I'm going to show you how we work on the muscles for patients who have had back surgeries or laminectomies. And his was in the lumbar region down by L4, L5. So I'm just going to work on his paraspinal muscles and show you how we do that. I always start with a myofascial release technique. My hand is on his pelvis and just on the inside of his paraspinal muscles in his thoracic region right now, and I'm just spreading apart. Good little stretch. That way I can just get the feel for his muscles. I do it on both sides so I know which side feels better and which side is much tighter. And I believe the right side is much tighter. Do you feel more pain on your right side?
Oh, yes, sir, for sure.
So, I was correct. The right side is much tighter than the left. And I've already forgot which way he was bending in there, but I'm sure that has to do with it. His right leg was the short leg, so that would probably be correct. So now I'm just doing deep, steady pressure in his paraspinal muscles. I'm above his scar from his surgery, and then I'm going to work down towards that scar, down into his L5, S1 pocket. And not only am I going down, but I'm pushing against his pelvis to try to create space in that area. So it probably hurts so good.
Oh, yeah.
Right. Feels good, but hurts at the same time.
Yes, sir.
But this is exactly what he needs. If he does not work out those adhesions by his scar tissue, then he could have pain forever. Once the adhesions start to grow and get into the lower layers of our skin or our epidermis or dermis, then it'll go down to the bone, and then he could have bone sores. This right here could hurt him forever if he doesn't rip up that scar tissue. So it's a good thing that he watched the videos and came in immediately and didn't wait a whole year or more than a year. For Robert, any type of stretching down here in his low back and pelvis area away from the scar tissue is going to feel better, because what he needs is space so the nerve is unpinched. It's compressed right now. And I'm not digging in right on his scar, I'm on the muscles beside his scar. Lighter pressure right on the muscles, but about right here. Above it in his thoracic region where he's having pain due to it compensating for his lower back, it's super tight. So here I am using way more pressure. And he could probably tell you that.
Oh, yeah, for sure.
But you feel how these are ropey?
Mm-hmm.
And down here it's not so ropey, but
You go harder.
it's
up
still
also.
harder. But this right here is real ropey. And I'm not going to just focus on his lower back. I'm going to do his full spine so he'll benefit from everything. Because if you watch Doc's video, he did have some tender vertebrae here and his neck was out. So I'm going to work on all of it. So if you've had surgeries, you've had instruments put into your spine, you've had multiple surgeries, doesn't matter, come in and see us. Pretty sure we can help you. We'll at least give you a consultation and tell you what better steps to make your life better, even if we can't help you. That's tender.
Oh, yeah.
This is right here is from your head being forward. So anytime you look down, read, text, you're pulling on your trap. So to here, your trap goes here to here. So a lot of people always wonder why you get headaches and then mid-back pain. Well, that's because your trap goes all the way up to your neck, goes out to your posterior delt or your shoulder, and then down to your mid-back. If you're looking down, if you're a student, you're writing, you're going to have that pain, and that's because you're looking down. So the exercises we give you will help correct that during the day when you have to do your daily living. I do all the exercise Dr. Johnson gives everyone else, because as you see, I have to bend over, use my arms, look down when I'm working on patients. Have you been using heat when you're in pain?
Oh, yeah.
Never use heat.
Now I'm going to ask you this.
Yes. So what I asked him is if he used heat for his injury. Heat always or mostly feels good right at that moment. But then later you'll have pain again, and you usually go back to the heat because it helped you feel good at that moment, but it usually will make it worse. The best sports medicine, best thing for acute pain, inflammation is ice. Ice from your freezer, Ziploc bag, crush it up, put it directly on the skin where you're hurting for about 20 minutes, hour off 20 minutes. If you've watched baseball, basketball, usually when players get hurt, trainer comes over with an ice bag, wraps it with an ace bandage. That is the best thing you can use for acute pain and inflammation.
Just don't do the heating pad in your
Yeah, don't do the heating pad, don't do peas from the freezer, the little blue cold packs. They don't get cold enough. They don't have the same effect as regular ice. Ice don't feel good in the beginning, but like after 5-10 minutes, it'll start feeling good, and he won't want to take it off. It's just like athletes do that ice bath. They don't want to do it, but it feels good. It helps them, right? I'm sticking my elbow right down in here into his trap, his levator scapula. He has some tension right here from his forward head posture, and it's pulling on that. So I'm just trying to loosen that up using different techniques with compression and trigger point. Feel the difference in between these right here?
Sure.
This side is
This one's more
so,
relaxed now.
yes. So trying
sure.
to make his body more even, symmetrical. That's the advantage of coming here to Advanced Chiropractic Relief. We work the full body. Try to get you well as soon as possible. Don't put you on long-term plans. Hands-on. Haven't put ice or a TENS unit on him. We put our hands on him. Try to get him better quick as possible, so his wife can make him do daddy do's again.
Can't wait.
Yeah, right there.
Does that relieve the pressure? a
Oh,
little
yeah,
bit?
for sure.
And as you see, I'm trying to use all my strength. I'm not even touching the floor over here. And I'm just spreading apart to relieve the tension off that lumbar area. All right. So, I'm going to use the trusty old thumper on him. Let him get a little bit of relaxation. Then I'm going to show him the Superman extension that we like to call here, assisted and non-assisted, which will help him restore this curve in his lower back. And if you were watching the other video, Dr. Johnson said this part is starting to flatten out. So we're going to show him some exercises that will help that get better. So if you like, sir, you can just get up slowly and stand to the side of the table. I'll show you a little exercise that you can start doing. And that is the perfect way to get up every time. Every time, from the floor, from the bed, always get up that way. So the first one is the assisted Superman. You'll push yourself up as far as you can.
Okay.
If you can only make it here, just go to here.
All right.
Take your chin all the way up. Try to look all the way behind you. Hold that for a couple seconds. Come back down. Same thing. You're going to repeat this morning and evening. Build your way up. If
Okay.
you can only do one in the beginning, do one.
All right.
Build all your way up to like 10, 15. Then once you get stabilized, we'll add this in there. This is your arm straight out, and you're doing the exact same thing.
Mhm.
Still trying to look up, but you're only using your back muscles.
Okay.
This helps get your head back over your shoulders. It'll keep the lordotic curve in your neck and your back.
Sounds good.
Anything like this is your enemy. It straightens out the curve, more pain, tightens the muscle, gravity takes over.
Okay.
So up and back is going to be your new friend other than Dr. Johnson and me.
There you go.
All right, you feel
Sounds
better?
good. I feel a lot better.
All right, well, this is Joseph coming from Advanced Chiropractic Relief with Dr. Gregory Johnson. We'll see y'all next time.